Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Okay, hi, how's it going? Good morning.
Good morning.
So I have two questions. One, I wrote them down so I would be a little more concise, maybe. I'm just gonna read it. So last time I mentioned 2 years ago, I had a concussion in February. The CT scans after were normal, and there was no pineal cyst. After the acute phase, I didn't have any PCS symptoms. In October, I had the craniosacral treatment, and imaging after the treatment showed a pineal cyst. Since that treatment, I've had extreme hormonal imbalances, and after a year of working with a naturopathic doctor to balance my hormones, I'm still on a roller coaster. How can a pineal cyst affect hormone function and emotional dysregulation?
Good question. So just to be clear here, you had the pineal cyst was discovered in October of 2023.
Yes.
Okay, so that's been over a year.
Confirmed that there was no pineal cyst on the February 2023 imaging.
Okay, I'm just making sure I have that straight. Okay, and then what was the treatment that you had before?
The craniosacral treatment where they palpate the I guess like the fluid around your brain, and that's when and I even had to sign something saying in the forms beforehand, it said if you've had a concussion, don't do this treatment. But it had been 8 months prior. I didn't have any symptoms. I was like, oh, I haven't recently had a concussion. This is not still a problem for me. And so I had the treatment, and I was nervous about it, and I asked them beforehand, and they actually didn't write back until I got there, and so I was already there, and they were like, yeah, like it should be fine. But then I was completely not fine at all since that point afterwards.
When was the craniosacral? It was in October?
October 2023.
It was just one treatment?
One treatment. But literally that from that moment forward and still until now.
Was it all previous symptoms that started?
No, I didn't have PCS symptoms from February to October.
Right. No, I understand that. But are these symptoms are ones that you had from that previous concussion at some point? I know that you don't.
Yeah, but the acute symptoms like no, but there were new ones. So acute symptoms like I drove home and it was at night and all the beams of light. I was extremely sensitive to light. I was extremely hungry afterwards, extremely cold. The extreme sensitivity to noise, all of those things that it felt like I had a concussion again. Uh, and then the new symptoms were extreme hormonal dysregulation. So I started getting morning nausea. I started like dry heaving in the mornings at certain points on my period. Like we thought I was pregnant. I went to the ER. Like they were like, "What is happening to your body?" And those things would cycle every time after that craniosacral treatment. Those symptoms would cycle every month at certain times during my period.
So it would get worse around your period.
Yes, at certain points in my cycle.
Okay. And then how did they find the cyst? Was it like imaging done right away?
They were doing imaging because they were just trying to figure out what was wrong. Nobody thought it had anything to do with a concussion because I hadn't hit my head again.
Right.
And so everybody was just doing imaging because I wasn't functioning at all. And they were trying to figure out what was wrong. And that's when they found the cyst. And they were like, oh, yeah, this probably doesn't mean anything. It's inconsequential. But that's when I called the imaging from before. And I was like, hey, was this present in February? And they confirmed that it wasn't. So
This is an MRI that was done
I believe it was,
or CT scan?
I believe it was a CT.
Have you had an MRI?
I believe I can't remember. I believe I've had both. I believe that maybe the first one was an MRI and the second was a CT, but I would have to confirm. I don't remember exactly.
Okay. Obviously, first of all, I want to just make sure that everyone understands, there's a lot of very personal information here, and we're not giving you a treatment recommendation, where you're just sharing
Right.
your symptoms freely. Now, I mean, we're none of us are experts in craniosacral. So I don't think we can comment on what exactly was done, and what I know of osteopathic medicine and craniosacral. I'm kind of lumping the two because they usually kind of work on the same type of like very subtle type of movements. I've seen osteopaths do some similar treatments. It may have shifted some CNS around, or it may not. It might have been something. This might sound a little hokey, but it might be actually something totally energetic, because there is an energetic nature to our bodies as well. But that is an area that is well above it's just very unknown, and it's incredibly unpredictable. So yeah,
So
I
as
mean,
far as the hormone function and the cyst presenting after this,
yeah.
can cysts affect the regulation of hormones?
The hormones that you described, the pineal gland doesn't really have a huge role to play. The pineal gland primarily is responsible for the circadian pattern and the production of melatonin, particularly. But it's really the pituitary gland and the hypothalamus that really is regulating hormones. So at this point, I don't see a strong connection there. That's why I'm saying it's really atypical.
Yeah,
So,
I mean, my sleep also did get really bad.
yeah, I'm
But
thinking just to like zoom out, like big picture, right? There's this concussion 8 months prior to the treatment. There's mold exposure. There's COVID. Then this treatment.
yeah,
So if you're looking at this big picture, there is a number of big stressors on the body. So
there's two more too. There's two more
and there's
stressors.
more. Okay, right? These are all huge stressors. So I'm thinking it's
yeah,
less about the treatment.
yeah,
That might have been that tipping
It's just
point,
that
right?
that was like
That was the tipping point.
the
That was
line of it was like the line in the
yeah,
sand of really, really being full functioning before that and being extremely full
yeah,
functioning after that. Or not,
absolutely.
sorry, extremely not functioning
Not
after.
yeah,
functioning. And we've heard this before. Yeah, we have had members with the same types of stories where this one small trigger seemed to be the tipping point, which made no sense. And it can be really dysregulating to think about a small trigger as becoming this huge event. Of course, we can't diagnose and we're not able to look into this further to say, hey, this specific thing that happened in your osteopathic treatment is the reason all of this happened. But in our area of expertise, zooming back on this full picture, there were a number of significant stressors leading up to this point. So I
True.
think, in my expertise, all I'm able to say is maybe less emphasis on that treatment and more emphasis on the big picture of what led to that experience, because a lot of things cascaded and created a lot of turmoil for you. And I think the big
yeah.
picture might be more helpful than just that one specific treatment, since we explored it quite a bit today, and there wasn't anything physiological that happened in that moment that sounded really
Yeah, exactly.
damaging, right?
I guess that leads into my next question, which I'll make quick. Is that one of the patterns that I see when I implement? Like I've been extremely religious about how I've been going about getting well. Um, and one of the patterns I see is that when I implement something new, I see a massive improvement. When I started supplements like multi-mineral, I looked like I reverse aged. My skin looked amazing. I had so much joy and energy. And then I was like, I'm well. And then it kind of tapered off. When I started implementing the exercising every day, I had really great mood, this great energy. This lasted for like 2 months. And I'm like, I'm well. Then same thing. About 2 months ago, I cut out all the sugar, processed foods, gluten, dairy. 2 months, I was like, my hormones are balanced. This is amazing. And then now they're not again. But I'm still doing all of those things. So it's like I'm being really consistent as far as taking the supplements, doing the exercising, eating 100% clean. And it's frustrating because it'll be really great at the beginning and I'll think, "Oh, this was the missing piece." And then it will just kind of slide
Yeah.
back again.
Yeah.
So
And I think
that's why I was
that leads,
asking if there was something more underlying rather than like these foundational core things.
one of the simplest things that just comes to mind just really quickly, because we're over time here,
Yeah.
just test these things. So like if you have a question about hormones, and this is where you can kind of go
Yeah,
back to
yeah,
your
that's already
doctors.
been ordered. Yeah, that's
Right.
been ordered.
Exactly. So if you're waiting on that, like if you're like, oh, my hormones off, if they're actually off, then you'll find issues on labs and blood work and additional testing that will prove that it's off. And then to Melinda's point, you can start looking at piecing together that environment and the kind of the situation that led to that, the multifactorial situation that led to this straw that broke the camel's back, so to speak, with this particular treatment. So collect that data, and that will prove to you to say, hey, this is what's going on. It's sometimes pretty common where patients will get better initially, where those things are all good, but they're not the root cause. Supplements are helpful,
Yeah, that's what I'm trying. I know
but
that
not the
they're
root
off.
cause. Yeah,
Yeah,
so
yeah. I
that
know that they're
happens.
off. I'm just trying to find the root cause.
Yeah. So message me on the forum and we can continue the conversation offline just for
Okay,
the
great.
sake of time here. I do have a
Thanks.
couple other thoughts if you want to, because I really, we all
Okay,
kind of
great.
feel for this situation. We want obviously to see you get better, but we can pick this back up in future lives or
Okay,
offline.
thank you. Thanks again.
Can I just chime in? I know you're trying to wrap here, but I just want to kind of go back on the thread that Melinda was pulling on of just terms of there's multiple causes, right? Like you said, oh, it has to be the concussion then because the symptoms are similar to concussion. The symptoms of concussion and PCS are non-specific, meaning that they're not just concussion. That the reason why the treatment for concussion is we don't treat the concussion, we treat all the other potential causes of those same symptoms, right? Like when we're treating people with PCS, we're not treating their brain. We're reducing inflammation. We're balancing the autonomics because dysregulation in those systems is what causes those same symptoms. So you have a number of stressors that lead up to this. COVID can cause the same symptoms as concussion, right? And the treatment is essentially balancing autonomics, reducing inflammation, getting good sleep, all these other things. So although the timing of this treatment tends to overlap with what your experience is, there could also be a factor where if you have this experience, you're starting to feel symptoms, well, then you start to kind of spiral. It adds more stress to an already stressed situation where you start thinking, oh shit, why am I feeling like this? Did this bring this back? And now all of a sudden you spiral kind of out of control. And then now you have anxiety that flares up, that starts affecting sleep, that starts affecting hormones. You know, the added stress can start to do that. Now, concussion by itself can cause hormone dysregulation. We have all sorts of evidence that concussion by itself starts to cause pituitary dysfunction in some people, but it takes 8 to 12 months before that
Right,
starts
right. I'm
showing
reading
up.
about that now.
So the
Mhm.
timing of this could just be the sense that you're dealing with the hormonal fluctuations that happened as a result of the concussion, but they've come on because of the other stressful events that happened that just eventually led to this, right? If you think back to like the concussion cliff analogy, it's like you may have felt good, but you were standing right on the edge of the cliff. And then a number of stressors came along, which actually pushed you off the edge. So you're saying, oh, this must be concussion. No, it's not. It's dysregulation in these systems. It could be just a lot of anxiety and stress in your life that's affecting all these things because that's going to influence your hormones. That's going to cause inflammation. That's going to cause gut issues. That's going to cause all these other things. So it may have something to do with the cyst. However, the cyst would likely be more related to just sleep dysregulation and melatonin just because of the location of it. But most of the time, these cysts are actually asymptomatic. Like people
Yeah,
they don't
totally
cause any
may
issues,
have
right? So
nothing to do with anything.
the majority of the time, they're completely asymptomatic. So this might be just a red herring that you're really focusing on. And that's potentially driving more stress to be like, oh, this treatment caused this cyst or something along those lines. And that's just adding more stress to the system, which is causing further dysregulation. So that's why I think we just need to take a step back. Think about this of like, okay, these are the symptoms. These are the potential drivers of those symptoms. Hormones may be one. You're getting it checked. Great. But at the same time, it's like, just continue with the plan. Try not to be so stressed about, if I add something, I feel great, and then I start to kind of, go downhill again. Um, Try not to be so, rigid on it, and just try to be more, I guess, kind of relaxed in the approach in a way, because if you have that like diligence, and I have to do this and I have to do this, that's just another stressor.
Right, and
Um,
I think I just wanna capitalize on it because it's so important, and I think it's so important for our audience as well, is looking for a why, right? We always look for a why. Tell me the one thing that caused this downward spiral, because then I can focus on that and get back to my life. But sometimes if we hyperfixate on the why, it actually just spirals us so much further down. So I'm really hearing that throughout this whole conversation is there's got to be a reason, right? It's got to be the osteopath, or it's got to be the hormones, it's got to be the cyst. Of course, we're doing that, right? And every single one of us here, including ourselves in our own experiences with health, are we're going to look for this why. But sometimes it actually complicates our healing and recovery and leads to more suffering, right? That brings us to that pain times resistance equals suffering.
Mhm.
We've got this pain, something happened. We're resisting it. Not that we're saying, hey, this isn't happening, but we're resisting it because we're just trying to figure out why. And that's the only thing we're focused on. And what ends up happening is we suffer more. That's a huge added stress when we're just focusing on the medical reasons for what happened. It makes sense to do that. What I always say to my clients is let's do that in moderation, right? You have to live
Yeah,
in
I let
between.
go. I let go of that
Yeah.
why. I think I'm only circling back to the why now be after I'm implementing all these things, and
Yeah.
then I'm still not well. So that's why I've circled back to the why, cuz like I did the mindfulness modules and all this stuff. I was like, "You
Yeah.
know what? I just need to let this go. It's not serving me. It's not helping me." But then when like the exercise plus the supplements plus all this stuff plus the sleep stuff isn't making me well, I'm circling back to the why to figure out like, okay, why has it been so long of me being really consistent and still not being well?
And that's part of this grieving process. We talked about this in Alive, right? We go into this mode of let's fix it, right? Then we lean back into, okay, let's let it go, right? Let's be compassionate. Let's like slow things down. Then we can go back into a grieving cycle of no, I need to fix it, right? And all of that is normal. I really am just pleased, and it's so helpful that you shared this with us because it touches on such an important topic of the journey through some of these really complex symptoms. None of them are your fault. Nothing that you
Right.
did caused this for yourself, but it feels so out of control that we do everything we can to try to regain control. And then sometimes when we hold on to that too much, it actually creates more symptoms because stress in the body creates more tension, increases our symptom flares. So it's this whole conglomerate of, complex health issues that's happening for you right now. And none of it is wrong, right? You're doing everything you can to support yourself. I think I just want to extend that invitation of see if you can go with the motions of it, right? I sometimes work with clients and I say, pick 1 week of the month where you focus on the why and work on your health and have all your appointments. Then another week of the month, you don't do any of that because what you need to do is just get out and walk or live your life or see a friend or work or whatever it is. Then 2 weeks later, you might take another week where you focus on the why, right? So it's finding a balance because if we're constantly in this mode of let's fix, I mean, and that's why you're here, right? Is to ask these questions and to try to figure out the why. But just to bring this awareness around, how much this can create weight for us in our recovery from anything complex, not just concussion. But again, this is very much what our members experience with PCS.
So you're saying don't for the whole 4 weeks, don't focus on the like exercising every day and eating no sugar and all that stuff. Like don't
I
always do that.
I think the guidance or the routine that you're in, yes, like if walking every day is recommended by Dr. Kim and working on the diet is recommended by Dr. Paul. What I mean is keeping our mindset in a place of I don't have to over focus on this stuff. I can carry on with the routine I have and let go of the rest. And 2 weeks later, maybe I pick up one more thing, but finding a balance for yourself so that we're not in this state of hypervigilance of what do I add next? How do I figure this out? Why did this happen? What do I, how could I have done this in the past?
Yeah. The other thing, just one more final thought before we move on, because we do have to move on. But the other thing to consider too is like when you start doing something, like you mentioned exercise, you were doing it feeling great. What starts to happen is when we start feeling great, we end up, we generally start to do more, and then that can cause kind of some of that setback too. So just kind of keep that in mind of not, even though you're feeling good, don't try to go out and do a whole bunch of things, because then that could set things back as well, because it just creates more kind of stress on the system. So you want to just do things in a very gradual, orderly way, and just kind of be mindful of that. I'm not saying you did that, but I'm just saying that can happen as well. So just keep that in mind of as you progress. I mean, you're doing the things, get the hormones looked at, see if there's anything there. If there's nothing there, great. Then you can cross it off your list and say, okay, what else could be contributing to this? And oftentimes, if you've gone through and done things and had a lot of benefit, and then now you're starting to plateau, we always recommend just go back to the start and start over again, because you're going to pick up more things. You're going to have that potentially added benefit of things being like, oh, I've gotten out of that part of the routine. I'm going to start maybe implementing that again or whatever. But give yourself a break. I'm sure you've come very far, and just slow and steady wins this race. Okay, slow and
Yeah,
steady.
we're all sending you some compassion and warm thoughts, and thank you for sharing this with us. I think it's so important for everybody here today because, a lot of the members are in the same boat, and a lot of the listeners are in the same boat. I'm seeing a ton of comments in the chat too, sort of validating that.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.